Welcome back to the channel, everyone, in which we will be discussing that of septic shock today. Now, when discussing shock, it's going to be important to note that shock is classified as a drastic decline in blood pressure, which causes systemic hypoperfusion to bodily tissues. Now, what causes that drastic drop in blood pressure and secondary hypoperfusion pertains to the prefix of the shock. In this case, it is sepsis that has induced shock, hence the name septic shock. Now, before we dive any further, it is important that we first establish or define what sepsis is. Sepsis is a bloodstream infection that is considered a type of distributive shock, also known as a vasodilatory shock. With that being said, this refers to dilation of the vessels, reflecting the terms vaso and dilatory. When vessels are dilated, this causes a drop in blood pressure and accompanying hemodynamic compromises, which we will see shortly. So being that sepsis is a bloodstream infection, it is safe to say that some sort of exposure to a pathogen must have occurred, which has caused the patient's infection. You're probably thinking, in order to correct the infection / the sepsis, we need to provide some sort of antibiotics, which, yes, you're right, but there's a criteria we must follow before we get there. Remember, we are not just correcting sepsis, guys, but also the shock which pertains to blood pressure management to assure that of adequate tissue perfusion. When bodily tissues lack perfusion, this causes organ dysfunction and organ starvation, leading to organ failure. This is why shock is so dangerous to begin with, because of the risk of organ anoxia, or absence of oxygen to the organ, which progresses to that of organ failure. In order to diagnose that of septic shock, there's a criteria that must be met to classify septic shock. The criteria known as SIRS, or Systemic Inflammatory Response Syndrome, is a cardinal indicator that allows us to diagnose that of sepsis. Individuals who present with 2 or more of the symptoms associated with SIRS is when sepsis or code sepsis is activated. Let's look at the symptoms related to this criteria in the next slide. Now, the SIRS criteria involves 4 major signs and symptoms. An acute onset or a decline in mental status is also a sign that accompanies SIRS criteria, which is secondary to hypoxia. But let's focus on these 4 points. If a patient presents with any 2 or more of these symptoms, again, they meet the sepsis criteria as per SIRS, which can indicate septic shock. Symptoms include a pulse that is greater than 90 and or a respiratory rate that's greater than 20. Also, leukopenia or leukocytosis indicate an infection or increased risk for infection is also a part of the SIRS criteria. Lastly, a fever, which is a temperature of 100.4 or more, is indicative of infection, as well as hypothermia or poikilothermia, which is the body's inability to maintain a normal temperature, which is another sign or symptom that is linked within the SIRS criteria. Now let's look at some risk factors associated with sepsis, which include things that place individuals at risk for infection. Individuals with a compromised immune system are at risk of contracting an infection and possibly lead to sepsis. Long-term hospital stays places individuals at risk, or iatrogenic or nosocomial infections, which pertain to infections contracted within the hospital by the provider or the healthcare professional. Surgery also places individuals at risk for an infection, as well as diabetes secondary to hyperglycemia. When blood sugar is high, our white blood cells do not work well in this sugary environment, which places individuals at risk for contracting an infection. Lastly, older age is another risk factor when it comes to contracting an infection due to the fact the body's defense system is suppressed. Again, guys, shock pertains to a drastic decline in blood pressure, which causes systemic hypoperfusion to bodily tissues, which in turn can cause organ dysfunction and ultimately organ death. When our organs dysfunction, various symptoms are evoked based on which organs are primarily affected. Organ dysfunction due to hypoperfusion establishes hypoxia, which is low oxygen within bodily tissues. Hypotension, which is our next indicator, reflects that of low blood pressure, which indicates that there either has been a decline in fluid volume or a vessel dilation is occurring, which indicates that either vasodilatory or vessel dilation or also fluid volume has decreased, further leading to that low blood pressure. Remember, when a vessel dilates, blood pressure declines as well, causing hypotension. Non-diabetic related hyperglycemia occurs due to illness and or stress that the body is experiencing. When stress or infection / illness occurs, the body produces hormones including glucose to decrease the taxation on one's body, furthermore causing hyperglycemia. Our next indicator is that of a decreased level of consciousness, which is indicative of decreased perfusion to the brain, which reflects hypoxia. Take note that a decreased level of consciousness indicates confusion secondary to hypoxia of the brain. A decreased capillary refill, which is a capillary refill that is greater than 3 seconds, is also indicative of organ dysfunction in which perfusion to the peripheral extremities is decreased. Oliguria indicates decreased urine output, reflecting urine output less than 30 milliliters per hour. And lastly, guys, a decreased GI motility occurs due to decreased perfusion or neuropathy to the GI system, which can ultimately decrease intestinal peristalsis, leading to that of abdominal pain or bloating or constipation. Now, here are the stages when it comes to sepsis, beginning from the least critical to most critical. So we begin with the SIRS criteria, and remember guys, individuals are to have at least 2 of the symptoms in order for the code sepsis to be activated. Once sepsis is activated, severe sepsis is then examined, which reflects if organ damage has occurred. Now, speaking of severe sepsis, this includes lactate levels being greater than 4 and also hypotension being reflected. Now, lactate reflects a byproduct of anaerobic metabolism, in which the higher the number lactate is, the worse the condition may be. Now again, the higher the lactate, the worse the condition may be. Normally, our cellular processes occurs due to aerobic metabolism, in which oxygen is used to carry out cellular functions. Now, normally our cellular processes occur due to aerobic metabolism, in which oxygen is used to carry out cellular functions. Now, when there is a lack of oxygen, like in the case of hypoxia or hypoperfusion, this means there's a decreased amount of oxygen that is perfusing the tissues. When this occurs, the body switches from that of aerobic metabolism to anaerobic metabolism and uses carbon dioxide as its primary source of energy to carry out cellular processes. Now, in the case where carbon dioxide is used, a byproduct of carbon dioxide breakdown is lactate. Therefore, in shock patients, due to hypoperfusion, oxygen delivery and saturation is diminished, which can transition to lactic acid buildup. When lactic acid increases, this further causes lactic acidosis, in which we will see an increased lactate level, and if not corrected, complicate metabolic acidosis. And based on the disorder we're talking today, this can accompany that of septic shock, signifying end organ damage as evidenced by organ malfunction due to hypoperfusion of tissues. To make note of, guys, septic shock would be classified as continuous severe sepsis in which end organ damage has occurred. With that being said, septic shock is indicative of persistent hypoperfusion of bodily tissues as evidenced by a mean arterial pressure less than 65. Also, a lactate level greater than 4 or systolic blood pressure less than 90. Now, how do we treat this kind of shock now that we know the pathology of it? Well, it's pretty straightforward. Just remember this mnemonic. Let's create a fun vacation. This is our treatment mnemonic, guys. Lactate, cultures, antibiotics, fluids, vasopressors. Let's create a fun vacation. Again, our treatment for shock is let's create a fun vacation. Lactate, cultures, antibiotics, fluids, vasopressors. This is the steps we are following to counteract this specific type of shock. Now let's examine the treatment and define what everything is that we are doing. By drawing a patient's lactate, this will help us understand if in fact the patient is hypoperfused as evidenced by an increased lactate level. Secondly, doing cultures and sensitivity testing helps us, the healthcare team, identify what bacterium, for example, is causing the sepsis in the first place. This should be done prior to providing patients with broad-spectrum antibiotics. The next step is A for antibiotics. This is where we have identified the culture of the bacteria and are now administering our first dose of broad-spectrum antibiotics to the patient. What follows antibiotic administration is the administration of fluids. Specifically, we want to hang crystalloid solutions that will serve to increase fluid volume in our patients, which simultaneously will increase blood pressure. By increasing blood pressure with fluids, we also increase mean arterial pressure with the goal of maintaining it over 65 to reflect adequate tissue perfusion. Fluid will help provide a means of hydration for our patients, as well as perfusion to bodily tissues, further correcting, in this case of shock, hypoxia and hypercapnia. In the case where fluids alone does not correct blood pressure, which can also be evident by a MAP that is less than 65, we are going to provide vasopressor treatment to the client to assist in blood pressure management. Vasopressors press or squeeze / vasoconstrict blood vessels, and when this occurs, this furthermore increases blood pressure and mean arterial pressure. Now, vasopressor medications include norepinephrine, epinephrine, dopamine, and phenylephrine as examples. Considerations when using these medications is that of tissue necrosis due to prolonged constriction, because remember they press guys, or tightening of the vessel, and this will ultimately cut off circulation to tissues if not monitored appropriately. Now, extremity assessments including cool, clammy skin, decreased capillary refills, paresthesias, pain, pulselessness, and even paralysis are cardinal signs of ischemia, and if reflected due to vasopressor treatments, this is indicative of tissue hypoperfusion of the extremities. Let's now discuss the hemodynamics when it comes to septic shock. Heart rate is going to be increased in this case of shock due to the body's compensatory mechanism. When blood pressure is low, or the patient is dehydrated, or hypoxia is in play, the heart rate usually increases to compensate for the decreases just mentioned. Mean arterial pressure in this case will also be down due to the fact blood pressure is decreased. Remember guys, septic shock causes vasodilatory effects, which is why pressure is decreased. Vessels are dilated. MAP again, which is mean arterial pressure, is the reflection of blood pressure, and we want to maintain it over 65. A MAP can be calculated by simply examining the blood pressure and taking the systolic and adding it by 2 times the diastolic, and then dividing that sum by 3. Now, cardiac output, which correlates with the heart rate, is also going to be up due to compensation, guys. Cardiac output reflects the amount of blood pumped by the heart in the span of 1 minute, which should be between 5 to 6 liters. Central venous pressure in septic shock is going to be down, as this reflects the pressure within the vena cava prior to entering the right atrium. Due to vasodilation, there is a decreased amount of fluid and pressure within the vena cava, which will further decrease preload. Now, pulmonary capillary wedge pressure is also down in this instance, as there is a systemic vasodilation and fluid is not being transported to the heart promptly. As a result, there is a decreased amount of fluid within the heart, and specifically within the pulmonary artery, there is also vasodilatory effects present, which is why a decrease in pulmonary capillary wedge pressure is important or examined. Lastly, systemic vascular resistance within septic shock is going to also be down, as there is systemic vasodilation. Systemic vascular resistance reflects the pressure within the aorta, in which the left ventricle has to overcome in order to effectively eject enough fluid through the systemic circuit. Again, septic shock, guys, is a type of distributive shock in which there is systemic vasodilation occurring. All vessels are open. And we have reached the end of this presentation. You can follow this video up with any of the shock videos listed below, as this video is one of 4 videos within the shock series, guys. Thank you. See you next time.